Okay, all of us know that insurance is super confusing. There's a lot to remember, and most people don't really pay attention to this kind of stuff until you have to use it. So we thought it would be a good time to do sort of a deep dive into our plans, do a little bit of education on not only how insurance works, but things like paying your medical bills and some things to pay attention to with your prescriptions and things. So with that, Sarah and I are going to get started.
Yeah, buddy. We are going to do some basic healthcare terminology for you guys. We are going to look over our 2018-2019 benefits plans, just so that you guys can have a better understanding of what your plan covers and where you can look that information up. We're also going to look over the MyUHC website and their mobile app and what kind of tools they have that can help you. And we'll talk about our pharmacy benefits, and we'll give you a little bit of a behind the scenes, what we know that you guys might not know, and helping you figure out how to pay your medical bills. So, last night, I was sitting at home thinking, wow, I really need to look over the SPD and try to compare it to look over my EOBs and the co-payments and co-insurance. I want to compare my deductibles to what my premiums are in conjunction to my out-of-pocket.
Oh my God, what did you just say?
Yeah. Mind blown, yes. There is a lot of terminology in the medical field, especially with insurance too. So we're going to break some of the basics down for you, just as like a refresher, but also just for you to know.
Yep.
So first off, we have a premium. This is the money you're going to pay pre-tax out of each paycheck to have your insurance coverage. That's your premium.
All right. A deductible is the amount of money that you pay before the insurance kicks in and starts to make payments. Deductibles do not include co-pays, co-insurance, and if you're on one of the PPO plans, then prescriptions do not count towards your deductible. If you're on the HSA plan, however, prescriptions do count towards your deductible.
So kind of to help you remember, you can think PPO, no deductible. HSA, yay, deductible.
All right, so if you need to have a surgery that costs $3,000, your deductible is $2,500, then what you pay is the $2,500. The insurance kicks in and picks up the remaining $500, plus any additional costs after that for the remainder of the year.
All right, now we have an out-of-pocket max. This is the most you will pay out of pocket for covered services within a plan year. What goes towards your out-of-pocket is your deductibles, your co-payments, prescriptions, co-insurance.
Yep.
For example, you have a hospital stay that's $3,000. You have medication, which is $500. Your deductible is $2,500. You've already met that just with the hospital stay. To meet your out-of-pocket, you need to get $3,500. The hospital stay and medication together, you've met your out-of-pocket, and you will pay nothing for the rest of that plan year.
A co-payment or co-pay, this is a predetermined flat fee that you pay towards the cost for your medical visits, and then the insurance pays the remaining balance. Some of our plans have co-pays, some of them don't, and we'll talk more about that in just a little bit. So, for example, say you're on the PPO one and you go to see your doctor, you're going to pay a $25 copay for that visit. Remember, copays do not apply towards deductibles, and if you are going to get preventative care services, so your wellness checkup, those do not require a copay. However, if you're at the doctor for your wellness visit and you tell them that something is wrong, say your throat's been hurting or something, then that changes the reason for that visit to diagnostic, and then you will be responsible for the copay.
Now we have co-insurance. Co-insurance is the percentage that you must pay to share responsibility for your medical claims after you meet your annual deductible. So for example, only one of our plans has co-insurance. For example, it might be the insurance provider might pay 80% of your claim, leaving you responsible for the remaining 20%. Our PPO2 plan is the one that has co-insurance.
Yep. All right, so all of our health plans are a little bit different from one another. The plan you have determines when and how much you pay for your medical services. We're going to break each of these down for you and show you what you need to know about each plan.
We're going to go ahead and review the benefit summary. So that's good for you guys to know.
Yep. So where do you find the benefit summary, Sarah?
Oh my gosh, Anna Beasley, that is a great question. Caravis Connect.
Woohoo!
That is where you do your PTO, you enroll for any of your benefits plans. That's where you're going to go.
Mm-hmm.
You're going to click there. You're going to go down here to Document Library. Then you're going to see exactly what plan you have chosen right there. So I have a PPO 1. My benefit summary is located right there. Now, if you're interested in comparing your plan with other plans, if you scroll down some more, you'll see that the HSA benefits plan is there and the PPO 2 benefit summary is right there. So I'm going to go ahead and open my PPO 1 benefit summary so I can kind of review what's covered.
Yep. And you'll notice right off the bat under benefit summary, the name of the plan is Missouri Choice Plus Modified Balance 100 Plan AQIW, which nobody is going to remember. So to make things easy for you guys, we renamed the plans PPO 1, PPO 2, and HSA in the system. But don't worry, whatever plan you're signed up for, that is the plan summary that will default to your profile when you pull it up in the system.
So after that, you can scroll down a little bit. It's going to give you a breakdown of what is covered with your plan, hence plan summary. I'm going to summarize it for you. This is going to this first part is kind of going to give you an overall breakdown saying that you can go out of network if you need to go out of network, but remember that they'll likely charge you more. You don't need to have a primary care provider, but they can be helpful in managing your care. And also, as we said earlier, preventative care is covered 100% if you're in network. If you scroll down some more, it's going to break it down even more for you. It's going to tell you what you're going to pay for in-network care. So co-payments would be $25. Your individual deductible is $2,500, and what the co-insurance would be, and since it's PPO 1, there's no co-insurance, you would see something different there for the PPO 2 plan. You keep on scrolling down, it's going to tell you what your annual deductible is. So it's going to tell you in-network and out-of-network. And then if you go down a little bit, you see it says individual and family, and it's going to tell you exactly what you need to meet for that deductible. You scroll down more, you'll see what your out-of-pocket limit is. It's the same thing, in-network, out-of-network, and then individual and family. All right, so if you scroll down a little bit more, you're going to see here a list of services. This is going to be very helpful for you. What you can do is push Control F and then type in what type of service you're looking for. So if you need physical therapy, you can type in physical therapy and it's going to bring you right to that area. Then it's going to break it down to what is covered in your plan in network and out of network. So that's going to be very helpful for you.
All right, so we're not going to pull up the plan summary for each plan, but we did want to highlight a few things you need to know about our other two plans. So this PPO 2, like the other plan, like the other PPO, copays and prescriptions, they only count towards your out-of-pocket max and do not count towards your deductible. On this plan only, you are responsible for 20% of the cost of services after you've met your deductible until you reach your out-of-pocket maximum. And then also on the PPO 2, you have a separate $100 prescription deductible to meet before you get discounted copays.
Then we have our HSA plan. Some things you need to know about the HSA plan is all covered services count towards your deductible. You do not have copays. Let me emphasize that. No copays. If you're going to your doctor and you're paying a copay, you need to talk to your billing person there or just your provider and say, hey, can you rerun my insurance? I have an HSA. I should not have a copay. However, you will pay the full cost of the doctor's visit, which will all count towards your deductible. Also, once you've met your deductible, mostly only the prescriptions that you have are going to count towards your remaining out-of-pocket max until you've met that.
All right, so now that we've showed you what the plans are, what some things mean, we're going to show you the tools and resources that you have available to you 24/7 on the website and the mobile app.
All right, so first we're going to take a look at the mobile app. It's called Health for Me. We're going to see what they have to offer, what you can utilize. So when you log in, you have access to your Plan ID card, which is really helpful. If you run to the doctor and forget it at home, you can pull it up right there on your phone. You can find care like physicians or different services. This is also very helpful if you're once again at the doctor and they say, hey, we think you need to go to a physical therapist. You can search for it right there and see what is in network and probably even schedule it while you're there. Getting stuff done. You can also see your claims and review your claims. You can pay your claims online on your phone. And it's also kind of like a medicine cabinet. It keeps track of the prescription drugs that you're taking. And it's easy to order refills by mail if you're signed up for that program.
All right, so that was the mobile app. Now we're going to go into the full website. So hopefully you guys have all logged into this at least once. If you haven't, please do. It's www.myuhc.com. And when you first log in, this is what you're going to see. This is your home page. So there's a lot going on here. We are going to go through each of these tabs at the top: the home, find care and costs, claims and accounts, coverage and benefits, pharmacies and prescriptions, and health resources. So you'll notice right away that your group number is right there at the top, and you can view and print your member ID card too. So if you don't want to pull it up on your mobile app, maybe you lost your ID card and you need to order a new one, then that's where you can do that. You can do that for you or anybody in your family. If you scroll down a little bit, you'll see that you can add your primary care provider, and you can also add all of your healthcare providers. So you can put all of their information here, keep it all in one place, just makes it a little easier for you to keep track. You can add your phone number and opt into text messages if that's something you're interested in. You'll also see a quick snapshot of the Rally and Simply Engaged rewards. So that link will take you right to Rally, the dashboard, which we'll go over in a little bit. But it gives you a quick snapshot of how much you've earned in incentives. So please remember that you and your covered spouses all can earn up to $200 in gift cards towards the Simply Engaged program just by completing some pretty easy things. Right. Scroll down a little further, you will see some common services and costs. So this is going to be dependent on whichever plan you're signed up for. So this person is signed up for an HSA. That's why you're seeing no copays for anything. Scroll down a little further. There is a snapshot of the medical accounts, so the deductibles and out-of-pocket maxes. This is just going to be a general snapshot, so if you have multiple people covered on your plan, it's going to show you your individual and then the whole family together, and it'll show how much has been accrued. If you are using our deductible reimbursement program, a screenshot of this is perfect. This is what we want to see for your individual, so that is easy for you to get. And then down at the very bottom, I promise this is the bottom, you're going to see just a quick shot of your most recent claim. So you obviously won't see the dentist because our dental is through Guardian, but all these other ones are right here for you. So kind of just gives you an idea of the claims that have been processed most recently.
All right, now we're going to review the Find Care and Cost tab. This is going to be really, really helpful for you guys. So for instance, say, I always like to say physical therapy, but let's say you need to go to physical therapy and you want to see how much it'll cost. So you would search it in here. We're going to switch it up this time. We're going to say that you go to the doctor and they say you need a chest x-ray. So you can click on the medical directory And then here you can search if there's specific doctors you want to see or places, but we want to figure out how much it's going to cost. We're going to click on the cost estimate. We're going to type in chest x-ray. And this is what comes up. This is going to give you an estimate of different total costs for different locations. So right here, it can range from $24 to $265.
Holy moly.
See that up at the top there. That's a big range. So what you can do is choose which location you want to have it at, and it's going to save you money, which is very helpful for all of us.
All right, the claims and accounts tab, there is a lot going on here. So on the summary page, it's going to show you the exact same thing that it showed you on the home page. It'll just filter by the most recent. If you go over to plan balances, it's going to show you those deductibles and out-of-pocket maximums, but this is going to break it down by each person that is covered on your plan. So if you need to see each person individually, this is where you can see that. You can flip it to out-of-network. Hopefully you're not accruing anything out-of-network, but if you need to see it, that's where it's at as well. And then claims and accounts claims. This is going to give you a ton of filters. So if you want to see just your medical claims or just your pharmacy claims, or maybe all the claims you've had this year or all the claims for a certain provider, this is where you can filter those results. You'll also notice there is a button that says View Explanation of Benefits. This is going to be super important. You're really going to want to pay attention to these explanation of benefits. For each claim that you have, we'll talk about it a little more in a bit when we go over paying your medical bills, but this is where you can find those. You'll also see a big green Pay Now button. So a lot of providers do allow you to pay claims online. If you click that Pay Now button, it's going to take you to an outside provider outside of UnitedHealthcare's website. And whatever provider they use, that does not filter back to this page, which is why you see this Mark as Paid button. So once you've paid it, you're going to want to check that just to keep track. Just know that they do not talk, those websites don't talk to each other.
All right, now if you go to the Coverage and Benefits tab, this is kind of like what we reviewed in Caravis. This is going to give you a breakdown of what your specific plan covers. So this little video here is tailored to you specifically. Yes, they put your name in it, so you should watch it. And they're going to give you a breakdown of what plan you have. So I have the PPO one. It's going to show me exactly what is covered, what my deductible is. It's a very helpful tool. So what you can do is click on medical, and then it's going to give you a breakdown of different services. So if I'm interested in seeing a physical therapist, I would click on physical therapy, and then it's going to give me a breakdown of what's covered in network, out of network, and any additional details that I need to know. All right there.
All right, pharmacies and prescriptions. So no matter which link you click on this page, it's going to take you to Optum's website. OptumRx is the pharmacy benefit manager for UnitedHealthcare. So say you wanted to find the price of a drug, you would click Find Price of Drugs. Here we are, it takes you right to Optum's website. There's a lot you can do on this website. You can search for specific drugs, you can order home delivery, you can locate pharmacies. But say you want to pull up your full PDL or formulary.
What? What are you talking about?
You don't know what a PDL is?
No.
You know what? Let's talk about it. There is so much to keep in mind when it comes to your pharmacy benefits. We are going to go over the plan differences, what a formulary and PDL actually is. They are the same thing. Cost-saving programs that UnitedHealthcare uses, retail versus mail order, and then actually paying for your RX, which is drugs. Things you need to keep in mind.
Okay. The first thing to keep in mind is that what you pay for your medication depends on which plan you are on. So on PPO plans, you're paying a negotiated copay that are applied to your out-of-pocket max. It doesn't matter whether you've met your medical deductibles or not. These copays go directly towards your out-of-pocket max. However, If you are on a PPO2 plan specifically, you do have a separate $100 prescription deductible to meet before those copays apply. These copays are also the maximum amount that you would pay. So if your medication is cheaper than that copay, you're going to pay the cheaper price. So if you go in and the medication, the retail value is $4, but your tier one copay is $10, you're going to pay the $4. You're going to pay the cheaper amount.
And getting your medication with the HSA plan works a little differently because your pharmacy costs do count towards your deductible. So if you haven't met your medical deductible and your doctor prescribes you a medication that is several $100s, then you're going to pay that full amount up front until that deductible has been satisfied. After you've met your deductible, you pay the same copays as the PPO plans until you've met your out-of-pocket maximum.
Now, as a reminder, you guys, the out-of-pocket max is the most you will pay for coverage healthcare in a year. So on all of the plans, HSA, PPO1, PPO2, once that amount has been met, you're going to pay nothing for those services for the rest of the plan year.
All right, so you know which plan you have and whether you're going to be paying a copay or towards your deductible. The next thing you want to look at is the formulary or PDL, which is prescription drug list. This can be found on myuhc.com by clicking on pharmacy like we showed you.
So the PDL, the prescription drug list, or if you want to be all fancy like, you can say formulary. The formulary is going to tell you what tier your medication falls under, meaning how much you're going to pay for that medication, and whether there are any extra steps you or the doctor need to take before getting that prescription filled.
So UnitedHealthcare uses a ton of cost-saving measures which could affect whether and how soon you can get your medication filled. So we're going to go into each of these a little bit. The first one you want to pay attention to is prior authorization. If you look up your drug in the PDL and it says it requires prior authorization, then that means your doctor needs to provide additional information on why you need this specific medication because there may be some other more cost-effective options available.
Next, if the prescription drug list says your medication has a supply limit, that means that your plan is only going to cover a specific amount of that medication or for a defined period of time that you can take it. If your doctor prescribes you something that doesn't match the supply limit, the pharmacy will not fill your medication until they get further information from your doctor.
If your medication requires step therapy, it means that the insurance is going to require that you try other similar medications before the prescribed medication will be covered. Most of the time, this restriction requires a letter from your doctor stating why those other similar drugs were not prescribed.
And then last, we have exclusions. So think of it this way. If you're being excluded, it's not a good thing. Exclusion, exclude, not a good word. Basically, that means if that is on there, it means that you are responsible for the full price of the drug, and it's not going to count towards your deductible or your out-of-pocket.
All right, so we know that was a lot of information to remember. The good news is that all of this information is available to you at any time. All you have to do is go to myuhc.com, click on your pharmacy benefits, and then go into this information center. If you click education and understanding your PDL, it goes through all of the things that we just talked about.
Educate yourself. All right, so let's go through kind of a real life situation. You get a prescription by your doctor for Advair for your asthma. You look it up on your prescription drug list, your PDL, and see that it's a tier 3 drug, it has a supply limit, and the retail cost is $350. You also see there may be a generic version available that's a tier 1 drug. The retail price is $4, and it has no additional requirements.
All right, so if you're on the PPO1 plan and you decide to get the name brand filled, then you would pay $70 because that's the most you can pay for a tier 3 drug on that plan. However, if you're on the HSA and you haven't met your deductible yet, then you're going to pay the $350 if you choose to get the name brand filled. If you decided to go with the generic version, no matter what plan you're on, you're going to pay $4 because that's the retail price of the generic drug and is the cheapest option.
So guys, remember, you can always go back to your doctor and ask if there's other options. You don't have to settle for the first thing that's prescribed, especially if it's a name brand drug that may have a lower cost alternative that achieves the same results that you need.
Absolutely. All right, retail versus mail order. There's definitely some things to remember here. If you have any maintenance prescription, so a maintenance prescription is something that you take all the time to maintain your quality of life. It's something you get refilled multiple times, not just like a Z-Pak if you've got a cold. So if you have any of these maintenance prescriptions, United Healthcare is really going to push you to use mail order through Optum. Mail order gives you a 90-day fill and will have the medicine delivered right to your home.
So with mail order, they really want to push you to use this. You can opt out of it.
Mm-hmm.
If you are prescribed medication and you don't want to use mail order, like I said, you must opt out. You can go to the website and opt out there, or you can call the member services number on the back of your card. If you don't opt out of the program and continue to get that maintenance drug filled at a retail pharmacy, you're going to start getting charged an out-of-network rate after 2 refills, which will cost much more.
Yep. So you don't have to use mail order, but you do have to officially opt out. Just remember that. The good news is United Healthcare does have a contract with CVS pharmacies that allows you to get the same mail order pricing and even the 90-day fills at a retail CVS pharmacy. So you can go in and get that same deal by walking in, but only if you go to CVS. They don't have that contract with any other pharmacy.
That's what I do, CVS. Okay, so it's no secret that the cost of prescriptions have skyrocketed in the recent years.
Mm-hmm.
Though these prescriptions are expensive, our insurance does give us some protection, but there's also some steps you can take to make sure that you're getting the absolute best deal.
Yep. So if you have a tax-advantaged account like an HSA or an FSA, you can use those tax-free funds to pay for your prescriptions. You can also look to see if there are any manufacturer coupons for your prescription. I know that sounds crazy, but this is a big deal. Sites like GoodRx.com can help you find discounts that may be available and can help you save hundreds of dollars. So kind of an embarrassing story that happened to me recently. I wanted to go on a bike ride right after work. I rushed out of the house and forgot to grab my sunglasses. You may not think that's a big deal, but 10 minutes into the ride, a bug smacked me right in the eyeball, pretty hard. It totally pulled me over. Turns out I was allergic to whatever that bug was that hit me in the eyeball. My eye got really angry. The next morning I had to go to the eye doctor and he gave me a prescription for some steroid eye drops. When I went to my pharmacy, they told me that even with my insurance, those eye drops, little tiny bottle, was going to be $265, which blew my mind. She did say that there may be a coupon, so I went online, found one, activated it, and it turned that copay from $265 to $15.
15.
Yeah,
Whoa.
That's a big difference.
Coupons. Google it.
Yeah.
All right. Medical bills are confusing.
Mm-hmm.
We know this. Even personally, we know this. So what we want to do is kind of break it down for you. We want to tell you what to pay, when to pay it, and where to pay it.
All right, so say your son is playing in a softball game and he tears his ACL. He doesn't realize that it's a torn ACL at first. I mean, he's not a doctor. So after the game, he puts it on ice, next day, it's not getting any better, so he goes to urgent care. The urgent care takes an x-ray and then sends him to an orthopedic doctor who says he needs an MRI.
So as a benefits person, all I hear right now is urgent care, ching ching, x-ray, ching ching, MRI, ching ching, orthopedic doctor. That's like beyond the ching. And we haven't even gotten to the surgery yet, which is pretty, you guys get it. It's intense.
All of this stuff can add up really quickly. The cost of an MRI, like we showed you, can vary by over $1,000 depending on where you go. But you can use some of the tools that we showed you to search for the right providers that charge reasonable amounts for these services. When you undergo a surgery, so we know he needed surgery, there are many providers involved. The hospital or the surgery center, the anesthesiologist, the surgeon, et cetera, et cetera. Even though this is a one-time event for you, it's common for all of these providers to bill separately, meaning you're going to get several bills in the mail.
This is very true. My son had ear tubes, and when we got the bills in the mail, there was one from the anesthesiologist, one from the hospital for using a room, one from the doctor. They all came in at different times. So, okay, I get the first bill in the mail. Do I pay it as soon as I get it?
Nope, don't do it. There are some things that you need to check first. All right, I wish I could tell you that our insurance and all of our providers work together seamlessly, but unfortunately, that is not the state of our healthcare system in this country. That's why you keep seeing it in the news all the time. To make sure you are paying the correct amount, you need to keep track of a few things.
All right, so first, make sure every doctor's bill you get in the mail has a matching EOB that you can pull from the MyUHC website or on your mobile app. If you receive one but not the other, don't make any payments till you have both in hand.
The reason for this is that 95% of bills that come from providers are system generated without an actual human ever looking at it. Sometimes they get sent before the insurance claim has even been processed. Sometimes the claim gets processed, but you made a payment at the provider and it doesn't take that into account. There are so many circumstances that can affect what comes out of your wallet that you really want to match everything up before you pay anything.
Definitely. So you also want to make sure that you know exactly what you've paid towards your deductible and your out-of-pocket amount for that year, and that those are accurately reflected in your bill. Because sometimes that's going to get overlooked and maybe you met your deductible. You don't want to overpay that.
So if you see any inconsistencies with any of these things, call that provider directly and make them go over it with you before you pay them anything. If you don't, you could end up paying much more than you actually owe, and you may not be reimbursed for quite a long time until it's reconciled by that provider. I have paid something over what I owed, and I didn't get reimbursed for 2 years after the fact. All right,
so now that we know where the bills are generated, knowing that, you know, sometimes they're not even seen by a person, and how much we owe, now what do we do?
So you've got a couple of options now. If you haven't met your deductible, you still owe a pretty large amount, you can call that provider and set up a payment plan. Any provider will set up a payment plan with you. You just have to ask. If you have a tax-advantaged account like a health savings account or flexible spending account, use those funds to pay and then save taxes on those money.
Definitely. And my friends, my dear friends listening right now, don't forget about Buckingham's deductible reimbursement program. After you've paid $1,000 towards your medical deductible, the firm will reimburse up to the next $1,300 of that deductible via direct deposit into your bank account. And wait, it's not just for you, it's for each person covered on your plan. Utilize that. That's what we're here for.
Also, remember that if you pay any bills online through providers like Instamed, if you click that Pay Now button on UHC's Claims tab, just remember to write down your confirmation number in case any questions come up about whether you actually made that payment. And when in doubt, remember to reach.
Reaching. You just can't see it. There's reaching.
Totally reaching.
I was totally reaching. We should do our own podcast. Research first. This is important. Research to see how much, an x-ray is going to cost and see if you can save money there. Research prescriptions. Make sure you know before you just go.
Yep. Make sure you have an EOB that matches your bill before you pay anything. We showed you where you can find it. If you don't have both in hand, do not make a payment.
Ask questions. So if you're your doctor and they prescribe you something and it's a name brand drug, make sure you ask, hey, are there other options? Is there something else that maybe we can look into?
Mm-hmm. Check your numbers. Make sure you know how much you've already accrued towards your deductibles and out-of-pocket amounts, and just keep tabs on your claims. Know what your numbers are.
Definitely. And have courage to speak up. You're the only one that can advocate your medical needs and your financial needs. It's on you. It's okay to ask questions. It's okay to have them rerun your insurance.
Mm-hmm.
You have to advocate for yourself. So have the courage.
Have courage.
Reach down. You've got this.
Yeah. Remember that when you're at your doctor, most of the time, I'd say probably 99% of the time, they have no idea what insurance you actually have. So they don't know what's going to be coming out of your pocket. You've got to be the one to advocate and speak up for yourself. Let them know, hey, I've got an HSA plan. I haven't met that deductible yet. Are there any other options for me?
Yep.
All right.
And they're probably going to appreciate that you actually spoke up.
Yep, absolutely.
There we are.
If you have any questions at all, either of us are here for you all the time. I'm Anna, that's Sarah. We've got an inbox, benefits@damadvisor.com. Check us out. Subscribe, like.
Subscribe, like.
We're here for you. Thanks.
Cheers.
Ching, ching.